Today's skill is nail care. Wash hands, knock knock. Good afternoon, my name is Xavier, I'll be your CNA for today. Is it okay if I check your wristband? Mary Jones, nice to meet you. How would you like to be addressed? Mrs. Jones? So Mrs. Jones, I'll help you with nail care today, is that okay? I'll be right back with the supplies. So I'm gonna wash my hands, gather the supplies. So after I get the supplies, I'm gonna come back into the room, knock knock, I'm back. I'll wash my hands, close the curtains, and I'll put on my first set of gloves. After putting on the first set, let's go ahead and grab some water, it's 105, and make sure that it's soapy. So this is also soapy water. I test it and I'll have the patient test it. So Mrs. Jones, how's the water? They say it's fine. Before I soak the hands, check the hands for any redness, any abnormalities in the hands, and then we're gonna soak it for 3 minutes. After soaking the hands for 3 minutes, we're gonna go ahead and push the cuticles. So I can ask them if they want to use a washcloth or if they want to use an orange stick. We'll start with the washcloth first. So this is a dampened washcloth. I'm gonna put my finger on one side and then push the cuticles. So as you're doing it, keep turning the washcloth. And then I'll proceed to do the next hand as well. This goes in the hamper. If the patient wants to use an orange stick, just make sure you use the side that's slanted, and then you mentioned that there's some cotton at the end for safety. So this one, if they choose this, you just kind of push the cuticle and then clean it on the Chux, or you can also clean on the towel, just make sure it's away from the patient. And then as you're doing it, you can just kind of like lift each finger, just kind of like, check the skin. After cleaning under, the cuticles, you're going to clean under the nails. So under the nails, you're gonna use the pointed end, and then you're gonna clean under the nails. So same thing, make sure you clean each time. You can clean on the Chux or on the towel, just make sure it's away from the patient. This will go into the garbage. And then at this point, I'm gonna change my water. So I have new water, it's 105, no soap, just regular 105 water. I'll change my gloves as well. So these gloves I'm gonna change. I'll wash my hands, and then I'll put on my second set of gloves. Also, remember to test the water to have them test it for safety, so they say it's fine. We're gonna rinse off the hands, and then I'm gonna actually have the patient lift up their hands for a few seconds, and then I'm gonna actually flip the towel to a new side. So if you can lift up your hands for me. And with this side, I'm gonna go ahead and pat dry. So from here, we're gonna clip the nails. So I'm gonna clip the nails straight across. We don't wanna cut around because we might create a hangnail. So cutting straight across, put the clippings onto the Chux. So again, cutting straight across for safety. And the clippers will go to the dirty designated area or the personal grooming kit. So I'll say dirty designated area. We also will file. So from side to side, we're gonna file the nails. Okay, and then when we're done, we can ask them, would you like any lotion? If you're the partner, just say no, but if they say yes, or if the nurse would like to see you do it, you have to remove your gloves. You're gonna wash hands, and then you're gonna go ahead and apply lotion. And you're gonna apply it going upwards towards the patient, or with your thumbs, and that will help promote blood circulation back to the heart. All right, so I'm gonna go ahead and wash my hands, and I'm gonna put on my next set of gloves. So this is my third set, and I'm gonna go ahead and remove the supplies. Okay, so I'm gonna remove the towel. I'm gonna dump this, rinse and dry. All the personal belongings will go to its designated area. I'll remove the Chux. Remove the gloves and wash hands. So Mrs. Jones, here's your call light, your phone, tissue, water, and magazines. If there's anything else you need, just let me know and I'll be right back. So I'll open the curtain, wash hands, step outside, record, and report.